I recently received a question from a follower about steroids and canine lymphoma. And this is what she asked. Do you recommend that GPs hold off on starting steroids at the time of diagnosis? As a GP, I usually do start steroids ASAP and then recommend referral to oncology to start chemotherapy if they're interested in that route. Just wondering if I need to change my protocols. I love this question, so let's go through my answer. I would definitely recommend that you don't start steroids while you're sending the patient for referral or the owners are deciding whether or not to do chemotherapy. Why? Steroids, such as prednisone, have been shown to make chemotherapy less effective by inducing something called multi-drug resistance. How long do they need to be on those steroids? It's thought to be 2 weeks, but maybe even a week. So the best thing to do is hold off on starting steroids. If they're not eating, you can use an appetite stimulant like Entice. And if there's going to be a delay in getting them into the oncologist, you can start something like Laverdia, which is a conditionally approved drug to treat lymphoma, which will not make the chemotherapy protocols less effective. So the take-home message is for dogs with lymphoma, it is so important that we hold off on starting steroids unless the dog is having a life-threatening emergency related to their lymphoma, because again, it can make the chemotherapy less effective. Something that I've seen over the years is that the owner's initial gut reaction is that they wouldn't do chemotherapy. They start steroids, the lymph nodes go away, and then they change their mind. And unfortunately, those dogs are relapsing a couple of months into chemotherapy. So what do you think about this?